Hello, I'm delighted to welcome you to this special product live session. Today we're coming live to you from the Wound Care Today in Milton Keynes. And with Mike Steele, who's going to tell us a little bit about Pico 14. Hi Mike.
Hi Joy, thank you, it's good to be here. I think whenever you start looking at new products or innovation, it's important to look at, well, what's the problem, what's its purpose that it's trying to help to solve. So with Pico 14, we're really looking at stalled, hard to heal wounds generally in the community. So these are the wounds where those listening that have the caseload, seeing every week, often more than once a week, weeks on end, months, and it takes a huge burden of the workload, and particularly for the patient. So that's what we're looking at here. You start looking at some of the evidence. So this one's Dowsett. Some of those patients, a third of them nearly, have been suffering with these hard to heal wounds for nearly, over a year.
Yeah, can relate to
so
that.
recognising it's a huge burden on those patients suffering with that, but also on the nursing staff having to cover these wounds. There's a lot of time and workload that's taken up, and obviously a huge cost to the NHS. So these are the areas that we're looking with Pico 14. So I guess we're moving on to Pico 14. So it's designed really for those chronic hard to heal wounds. So many of those listening will be aware of Pico 7. That has a lot of success, and we'll see those outcomes from that. So 14 really looks at a longer period of time, the 14 days. If you look at negative pressure and accelerating healing, the average time for that is normally needed for about 2 to 3 weeks. So Pico 14 is an optimal time period for that negative pressure therapy. The enhanced pump also means that not only is it dealing with a larger wound, it will go to much greater depth. So it'll go down to 7 centimetres, which is quite deep. It'll also, because of that depth, you can use it with some of the negative pressure wound fillers, so gauze and foam. So it really just starts expanding some of those wounds that you can now manage with negative pressure with Pico. If I was to point really to one of the key unique kind of features that's innovative, there's a number of things, but I'd really reference this, the airlock layer. And I think why this is particularly unique and impactful is what it does is it allows for consistent negative pressure across the whole surface of the wound dressing. So you're getting it across the whole of the dressing pad. Now, interesting, there's some recent evidence out that came out last year as an RCT with Kirsner. And the interesting part with there is against traditional negative pressure, which is obviously effective. Pico is even more effective than that. And the reasoning being is, if you look at traditional negative pressure, you've got your gauze or filler in the wound. You've got your negative pressure that's been delivered, but it's really just going to the wound bed. Again, with the airlock layer, because you've got a much wider zone of therapy, it's delivering not just the wound bed, but also the peri-wound skin and a much wider zone of therapy. Exactly. So in fact, we've seen it under CT scans. You can see the impact it's having on that much wider zone of therapy, which is quite exciting really to see really the reasons why these wounds are healing much faster, the reduction of the volume of the wounds. So it's really quite impactful that this, and the airlock layer is across the whole of the Pico range. So not just Pico 14, Pico 7 and as well. So it's quite
unique, isn't it?
It is, So I think if we start looking at some of the evidence around these hard to heal wounds that are stalled, again, this one's the Dowsett paper. So again, we looked at 52 wounds here that were stalled. Nothing's happening. Again, it's taking the big burden up, big costs for the NHS and the patients. We looked at just 2 weeks worth of therapy at Pico. This is Pico 7. And you can see on the graph there that the dramatic change really from those stalled to now kick-starting it we're back into a wound healing trajectory. I think the reduction here was about 21% per week, so quite significant. And in just 2 weeks, it's had that impact. And then you go back to conventional dressings, and you can see that continual healing trajectory still goes on in that rate, as you can see from the graph there.
Yeah, I can see that.
So the other piece I guess I wanted to kind of point out here again is timing. So these are stalled wounds, been in the books for a long time, and we talked earlier about a third of them being for over a year. Key really is early intervention. So once you know that this is a stalled wound, and you'll know that because it's not moving, and you've tried all the conventional methods, then early intervention is key. Again, here we've shown from the evidence that if you treat within 3 months, you get a much higher success rate, so 94% here. if you move that out to, if it's over a year, only a third of them are moving on to successful healing.
Yeah.
The wounds, as you all know, just get so much more stubborn, much more
really chronic and
absolutely
and stagnant. So key early intervention really is a key, and I think that is important to sort of reiterate that.
Absolutely.
It's really interesting. But would you mind if I ask you a few more questions about the Pico 14?
Yeah, please. Thanks.
Great. So what's the difference between the Pico 14 and Pico? I know you've explained a little bit, but what would you say some of the differences are?
Yeah, so some of it's trying to keep it simple. So Pico 7 is for 7 days. Pico 14 is for 14 days. So it's a longer period of negative pressure therapy.
Yeah.
I guess the key thing with Pico 14 is it's designed for those chronic, tend to be open wounds, so tend to be a lot larger. So we talked about the depth and the size of those wounds. So Pico 14 is designed really to manage what is essentially air in a larger wound in a more effective way to create that negative pressure. So some of the things you'll see visibly, I guess, is that because it's coping with a much wider, large volume of air, it's more effective at managing that airflow. What it means is to create the seal in a more consistent way. So what I mean by that, so Pico 7 is the drawdown to create the negative pressure. Takes up to about 65 seconds, whereas Pico 14 it's up to 100 seconds. So you'll see some of that visibly is the main difference you'll see from that point.
But the advantage we have is we can use that for it's a 14-day treatment as well.
It is, yeah. I guess the other thing I should point out as well, which is quite important, that obviously when you're looking at 2-week therapy, actually the dressings in the kit, you may want some versatility, you may need more, and therefore we've also got the separate dressings that are available as well.
Good idea.
So and they're on prescription
because
now.
it does, it's fab. Because that does give you that versatility for those different types of wounds, doesn't it?
Absolutely, yeah. And they can be used with Pico 7 and Pico 14 because it's the same dressing. So
interesting. We mentioned chronic wounds. Can you give me some examples of sort of what types of wounds this, it's been used on the Pico 14's been used on?
Yeah. So and again, essentially similar to Pico 7, all those wounds there. Essentially, if you look at your chronic wounds, so your typical ones, really, your diabetic foot ulcers, some great results there. Your leg ulcers, looked at the Dowsett and the Hampton papers earlier, a lot of those were that. Your pressure ulcers, and also look at some of your surgical, so your DHIS surgical wounds. And you look at the guest paper, does a lot of those as well. So some really good results on all those wounds.
Now I have to ask this question, is there a cost difference, obviously, between this and the Pico, so the Pico 14 and the Pico?
It's the obvious question that people are going to ask, isn't it? Absolutely. So yes, there is. I guess the best way to look at it is if you looked at over a 14-day therapy, so 2 lots of Pico 7 versus Pico 14, you're talking about a 25% sort of saving on price. Obviously, the key saving is these are stalled wounds, taking up a lot of time for the patient. It's really sort of challenging, but the cost of that is huge. So that's where the biggest saving is.
And obviously the biggest positive impact for the patients
absolutely
as well,
massive,
isn't it? So when and where is this product available?
Well, it's I'm glad you asked. It is pretty new still for the UK. So at the moment, it's really just it's available, so we can buy from us direct.
Right. Okay.
But for the other channels, really at the moment, NHS supply chain. We just wait to hear back from them. So as soon as it's listed on the NHS supply chain, we'll let everyone know. For the drug tariff on prescription, again, we're just waiting for confirmation of that. Right. So we're still waiting to hear. That could take a little longer, but fingers crossed a little sooner than.
So as nurses and clinicians, are we able to trial it though? Or can we trial it? And if so, how do we go about that?
Yeah, so absolutely. So I guess and it's worth looking at what accessibility you have if it's not on prescription at the moment, what options you have. But yes, we have it available now. So the key thing really is to pick up with your local territory manager and have some discussions with them, and they'll be able to work with you. So we've had 10 minutes and it's been really interesting, but it's not a long amount of time, a high amount of time. So how can we find out more about it? Yeah, and there is lots more to
there is, I'm sure,
So best thing to do is pick up, as I mentioned earlier, with your local Smith & Nephew, with a territory manager or complex wound specialist to be able to go into more details. And on the screen here as well, we've got an email address that may be more convenient for some to send through. We'll respond whichever way is easiest for yourselves.
That's really, really fascinating. Thank you for sharing that with us today, Mike.
Thanks, Joe.
And thank you so much for watching. We hope you found this session really useful, and I hope you'll join us again in the future for more Facebook Live sessions. Thank you.